Nō reira e te whānau, nau mai haere mai. Kuhu mai ki roto ki tēnei o ngā wānanga a Ipurangi. Tēnei pō ko te kaupapa te tiaki nei i ngā tamariki me ngā whānau i roto i ngā mahi i ngā kura huri no te motu. Nō reira, koutou e tūhono mai nei tēnei pō tēnā koutou, tēnā koutou, tēnā koutou me taku mihi anō ki ngā kai kōrero mo te pō nei. Māku e timata me te i paku karakia e pēnei ana te kōrero ko ngā huatanga ki ronga, ngā huatanga ki raro, ko ngā huatanga ki roto, ko ngā huatanga ki wau. Ngā huatanga o te ao te kitia kia tau ki rungi a tātou, te manaakitanga o ngā mātua tūpuna hei arahi a tātou, tūturu whakamaua kia tīnā, haumi e hui e, tai ki e. All right, kia ora. So welcome. This is our webinar. We've kind of got a specific focus tonight to talk about our kids and our whānau and keeping them safe. And we're thinking about kura and all of the educational institutions. We've got some guests tonight, a couple of principals from schools, and we've got a paediatrician, Dr. Danny Delore. I'm really grateful. They're going to talk each for about 5 minutes. And then we've got the question and answer function where people will be able to type in their questions. We've got a team of people who are going to answer some of those, and then we're also going to ask the panel to talk to some of those as well. Nō reira, ka huri ki a koe, kai tāne atua, ka mihi ki a koe te tuahine Marama, kai a koe.
Tēnā koutou katoa, ngā mihi nui ki a koutou. Ko puki nui o raho te maunga, ko te arawhatawhata te awa, ko te taia hape te marae, ko takutai o te rangi te whare tipuna, ko Ngāti Raka te hapu, ko tūhoi te mana me te rangatiratana, ko te paupāpaka te tanata ko Marama Stewart nei te pau tōku ingoa and ko te tūmoaki o te kura o tāne atua. Thank you very much for inviting me along. So I'll get right into it since I have a very short amount of time. So currently my school is in the middle of an Omicron outbreak. So what we noticed, and what I noticed was just the week preceding the full outbreak, we had a lot of kids coming into school. They were happy, fine. I always try and be in the playground in the mornings to greet kids and say good morning and make sure they get to the breakfast club. And then by about 9:30, we were having kids come in really miserable out of the blue, very high temperatures, shaky, crying, cold, even though they were very hot. And so we noticed it was very quick. While they were not tested, we were pretty sure what was going on. So yeah, I spent a lot of time isolating children away from other kids and getting them into the sick bay and getting them home. It was pretty scary at that time because this was week 4, week 3. Rat tests were not really readily available and there was long queues and we just didn't really know what was going on. But yeah, sure enough, I tested positive the following week on the Monday. I had my mask off once. I got caught running from my office to the staff room, grabbing a coffee, and less than 5-minute interaction with another child. And yeah, I ended up testing positive. It was a bit of a scary time. I think what our worry has always been is that if all the adults get sick on site, who's going to be there for the kids? What we've found that has worked for us as a kura is being very open and honest about our current situation. I've always used Facebook a lot. I don't particularly like it. I think it's a cesspool, Facebook in general, but the one advantage of Facebook is that it is free for those who do not have data or do not have credit on their phone. So I am able to get out messages on Facebook Live and I get more interaction and more feedback from the community through Facebook, because you can always message the school when you have no data or credit on your phone. So our focus changed from education basically to wellbeing and support. There were a lot of whānau who had no idea where to get isolation support from. Again, no credit on their phones to reach out to the organisations that were providing it. So we became kind of a Facebook hub for getting that information and communication out to whānau, and just being honest and saying, hey, it's okay to be scared. This is a scary time, but we are here to support. Here is this number, here is this email, here is this point of contact. If you're feeling too whakamā to ask yourself, give me permission and I will pass your details on and they will ring you, and they will contact you. So that was pretty successful, I think. I think it made a lot of families feel a little bit more certain about what was going on, and it also quelled a lot of the gossip, which I find often really affects communities. If you don't tell people what's going on, they will make up their own minds and they will pass it around, which is really damaging. It's very important in my position as a leader and as the board to understand privacy and getting information out and what can be shared and what cannot be shared. Remembering always that privacy laws are about protecting individuals or small groups of children from being identified by the information you give out. You can't control the gossip and the kōrero that's going on, but you can say, hey, there is a child that has tested positive in your classroom. We can't share any more information because of this particular law, but it might be a good time for you to start monitoring your children and making sure that they don't show any symptoms so we can keep our staff well. And yes, we did have a lot of kids stop coming to school and isolating, and that's actually kept our staff safe and not sick. So I didn't pass on my infection to anyone because I had a K95 on the entire time, and we've only started getting the rest of the staff coming down with infections now from outside contacts of the school. But I feel like the community trusts us now and they're listening to us and not bringing kids in if they've got runny noses or snuffles, and they're reaching out to us more often for help when they need it. Sorry, it's my kids screaming out the door. Yeah, I think, is there anything else you'd like me to cover?
Marama, thanks for that. There's a nuanced part of what you're telling us, which is about being really good and well organized about communication, really open and really regular, and also doing that in a way which respects privacy.
Yeah,
that's a really interesting contribution to make. So I'm really hearing that, and thank you for that.
Yeah.
Kia ora. All right. Now, whānau, I know mai te tokorau ki te tonga ko koutou ko tūhono mai nei. Everybody's joined. There's dozens and dozens of people. Ka hono, taki rua mai, taki toru mai, taki tini mai, kia ora koutou. You've got an opportunity to type questions into the Q&A function. We've got some people on hand who can start typing answers, and we can throw some of those questions to the panel. If you've got something specifically for Marama, type it into the Q&A. Ka tira, ka huri kia koe, te tuakana, Kimiora, nau mai. Thank you for joining us tonight. Kai a koe te wā.
Hei whai noi nā kōrero a Marama tēnei ka mihi atu kia koutou e te motu. Ka mutu mihi ana ki te kaupapa. Tā tātou kaupapa ko whaka imi mai a tātou ki te kōrero mo tēnei mea te Omicron. Nā reira mihi ana kia koutou. Ko Kimiora Webster tōku ingoa he uri ai no tūhoi te aroa te whānau apanui me Ngāpuhi. Wai mari e ke koutou ko ngā ngai tūhoi ko hara mai te kōrero kia koutou mo te kowhiori ai tēnei po. Ka mutu ko au te tumu aki ki roto i te kura o te whānau a apanui, mihi kau atu ana kia koutou katoa. Nā reira, tēnā koe rawiri o tira koutou, nā kai whakarite. I suppose I have to give you some context about the school in order for you to get an understanding of where our action plan came from. And so Te Kura o Te Whānau Apanui is a school that was set up in 2016 after the closing of 3 schools on the coast. As a result of that, we're geographically isolated. We set up a new school. We're in the middle of a new school build at the moment for our community. And And now we've got to deal with Omicron and also all the mandates and everything that are just getting bombarded at us in the education sector. So as we all know, 2020, Te Whānau Apanui went straight to level 5. We don't go level 4, we go straight to level 5, and we closed the whole of our rohe down. And that's when we all started to work as an iwi to look after each other. At that time, I think the focus was for us to keep the virus outside of our iwi so that we could, so that it wasn't a repeat of what had happened at the beginning of the century with the Spanish flu. 2021, we didn't have any borders, and that was the beginning of us starting to get to learn how to live with COVID-19 and Omicron within our community. And as a result of that, Dr. Rachel Thompson, as well as her team at Te Kaha Medical Centre, they were big on communication, and just want to follow up on what Marama said. Communication is key in communities like ours. So we try to pick up on that same thing that Dr. Rachel was putting out to our community. In our pānui, we always had a COVID-19 section in there to talk about what was happening, make sure you're ready for this, make sure you're prepared if COVID-19 affects your whānau. And then at the beginning of this year, we were still harping on about it to our community. Like Marama, we use Facebook as our main form of communication because, one, if we know it's going to reach the majority of our community, but two, we also know that they've read it. So that's one of the biggest things. And for our community, decile 1, low employment rate, so which means there's hardly any money in the household. We want to make sure we're reaching out to them as much as we can to help Dr. Rachel provide support for them, but also to help them understand that there's support for them out there in the case they are infected with this virus. So what we done as a kura was we decided to change our focus from trying to keep COVID-19 away from us, but to teach our community how to live with COVID-19. And so we want to make a plan that's sustainable, that is still safe for our community, but is secure and flexible for us as a staff here at the kura to keep our kura open. We're lucky, and I'll be straight up with you. Our kura is very lucky. We've dodged bullets because we haven't been affected like a lot of kura around the motu. Last week I had 3 cases, first time that we've had cases in the kura, and they were at school the day before. Once that happened, we went straight into our action plan, which was that whole classroom got shut down, stayed home for the week, monitored for symptoms, and then we advised our parents, this is what's happening at the kura, this is the amount of COVID-19 cases. If you want to keep your kids home, kei te pai, we'll bring work to you. If you want to send them to school, kei konei mātou. Tonu e tautoko ana I a koutou. We still got kids, we still had kids coming to school last week, and we're just starting to get the first wave of kids who were affected by COVID-19 coming back to kura now. At the moment, we're sitting around about 70% or attendance here at the school. But there's a whole lot of mahi out that we've sent out. So we're sort of doing a little bit of a hybrid slash face-to-face teaching at the moment. So really big on making sure our kids are wearing face masks, our kaiako are wearing face masks inside the classrooms. But when they're outside playing sport, then they're outside going for it. And of course, the masks will hinder that. So that's our plan. We wanted to make it sustainable for our community, safe for our community, and to keep our kids safe and also the staff safe, secure and flexible for everybody, which also means that the staff have to be flexible in the case that if staff did get infected, then we were able to shift into that classroom and carry on like nothing's happening. And that's one way for us to have a sustainable plan for us to carry on. So, pena tō mātou kaupapa I konei I te whānau apanui, mihi kauatu ana kia Dr. Rachel, rātou ko te Kaha Medical Centre and the team up there. Communication is key, and yeah, kia kaha kia tātou.
Kia ora, thank you, Kimiora. Awesome. Actually, there's some questions starting to come in now. One of them is about plans. So I'm going to come back to you on that. But right now, ka huri kia ki tēnei rata e tiaki nei te tai tamariki, Danny DeLore, so paediatrician from Rotorua, joining us. And thank you for joining us, Danny. Over to you.
Tēnā koe raweri, tēnā koutou katoa, nā mihi kia koutou, ko te arawa te waka, ko Ngāti Tuwhari tō tiwi. Hei mātanga aro tamariki a hau, ke Rotorua hau e mahi ana, ko Danny DeLore tōku ingoa. I was going to start with some just some medical points. One is that on the positive side about Omicron, which seems to have displaced Delta. I've got a memo yesterday saying that there was no Delta picked up in PCR testing around the country since 15th of February. So it seems to be getting some nods from Anthony. So I think that's right. Omicron seems to be the dominant virus, and it seems to have completely displaced Delta. Our best understanding is that fewer than 1% of tamariki will need to be admitted to hospital with Omicron. And if they're well immunized, it's probably far fewer than 1%. So that's really good news. It doesn't mean that Omicron is mild, and I would never call it mild, even if it's less severe than Delta. I was on call in the Hohipera or Rotorua last week, and we admitted 1 or 2 children a week. This is just in Lakes DHB. They were all under 3. Most commonly it was fever, febrile convulsion, and croup, which is an upper airway infection. But we didn't admit anybody over the age of 3, which is really encouraging to me, even though there was so much Delta around the community. And the average length of stay was probably 1 or 2 days. But that's not to say there aren't some children who are at high risk, and that's particularly children with neurodisability, children with chronic conditions, and I'm thinking particularly of children who have impaired mobility, who don't move around in a normal way, who might have impaired lung function. They're particularly at risk of having more severe disease. So if you have those tamariki at your kura in your classrooms, I think a lot of the decisions that you make and a lot of the incentive and motivation for doing these things we're talking about is to protect those children. A transmission can happen in kura just like everybody else. There's a temptation to close kura and classrooms and everything down quickly, but there's some good reasons that we want to keep schools open. One is that school is really good for children. Education is really good for children. But 2 is that if the layers of protection that we're about to talk about, if they're all in place and they're all working well, what they call the attack rate, secondary attack rate, or the chance that somebody will be infected is actually quite low. And the more layers you have in place, the less the chance of infection. The information from New South Wales is that for Delta, secondary attack rates or infection rates from one child to another in school were about 2.4% when all of these protections are in place. And for Omicron, it was a bit higher, more like 3 to 4%. But the more protections you have in place, the lower the risk. That's for one child infecting people in the classroom, kaiako and tauira. But if you have lots of children, that risk is cumulative. So if you have 5 children, that risk is much higher. And that's when we have to start thinking about restricting classrooms and closing schools. When you compare that risk with the risk in a household, in any household, the risk, if Omicron is in the household from one person, the chance to pass it on to another household member is more like 50 to 70%. In New South Wales, they've looked closely at where children pick up infections, and it's actually more likely that they'll pick up infections from other children outside of the classroom. And that's when they're ride sharing going to school. Or that's when they are doing activities indoors with other children where these measures aren't in place. Or if they're going to social gatherings, if they're at their friends' houses, birthday parties, those sorts of things. So sports indoors, that's actually a much higher risk where they don't have those mitigation things that we're about to talk about. So when you close your classroom or you close your kura, you actually have to think about where that child has to go somewhere. Those children have to go somewhere. Are they all going to be sharing? Is the care going to be all shared amongst a whole lot of whānau because parents have to go to work or parents have to do something else? If that sort of situation is going to arise, then that child might actually be at high risk where they're going to go compared to in your classroom. So just going to go through these layers of protection or these mitigation things. One is mask use. I'm sure everyone knows about this. It's you know, still see a lot of people, and I'm sure there's a lot of children wearing masks incorrectly or reluctant to wear their mask. You can't force a child to wear their mask, but the higher the quality of mask wearing, particularly if it's N95 equivalent, there's a real technique to that mask, and getting the mask on fitted correctly is really important. But any mask that you see, I mean, the higher quality mask, the better. But any mask that you see that's not being worn correctly, you want to do your best you can to get that mask on correctly, and creating a culture where it's just the normal thing to wear a mask. And even the children who don't wear a mask, I mean, we don't want to make them feel pressured to wear one. If that's their parents' choice, that's what they don't wear a mask. But just make it easy for children to wear a mask and not feel like they're the focus of attention for wearing one. I'm sure you're all experienced of that. Cohorting as much as possible, keeping children in the groups that they need to be in, but not mixing groups. And that means allocated areas. It might mean allocated playtimes, etc. And just having that message coming through to tamariki that this is your group and we'll try not to mix up our groups. Ventilation is really, really important. And it seems like a simple thing. It is quite a simple thing, but it's going to become more challenging as the weather cools. I think a lot of people have, well, it's really important to think about ventilation indoors as you're trying to simulate what happens outdoors, where there's a breeze coming from one direction, comes across and goes the other direction. And if you think about it that way, then it makes sense to have windows open on one side and windows open on the other side. A door open on one side, windows open on the other side. You're trying to get the breeze to come through just like it does outside, so that fresh air is coming in and stale air is going out. And I do see people doing this in the hospital, having fans going in all sorts of directions, having one window open. If you're doing something that just makes the bad air, the stale air circulate around the room, it's actually not helping. You need fresh air coming in, stale air going out. I know that there's toolkits going to schools. I think each kura gets one toolkit with a CO2 monitor. Hopefully those are available to you and you can use those to check each individual classroom. I think they're going to principals or deputy principals. There are property advisors available, and the Ministry of Education has a unit for ventilation. They're actually pretty well staffed and pretty well resourced. They can set a property. If you have a space in your kura where there isn't good ventilation, you can consult with them. You can ask them to come and check it out. And actually, this is a good time to do it while there's property managers available to come and assess your space. If it can't be well ventilated, then you can apply for an air purifier. Now, air purifier is not as good as ventilation, fresh air coming in, because it's not fresh air, but it's filtering the air that is in the room. And I believe there's 5,000 of those filters in the country. There's hardly been any applications for them so far. So they're sitting there, and if you want to get one, this is a good time to put your application in. But you need a property manager or somebody to assess what's happening with the CO2. That's the air that's breathed out. Is it just sitting in the room, indicating that there's no fresh air coming in? If that's the case and you can't improve the ventilation, there's options open to you to have someone assess that area. You can apply for one of these filters. Remember, the best ventilation, if you're going to have a machine, the air filters don't actually bring fresh air in. They're just filtering air that's in the room. But some air conditioning, the HVAC, some of that is ducted air coming in, so that's better. Heat pumps aren't ducted, they're just moving air around. So it can be quite complex. There are people available to help with that. Having children outdoors as much as possible, you know, that's just, you're basically having ventilation outdoors. Vaccine passes, it's come out this week that essentially this is how it should have always been, but tamariki and kura, well, they don't need to tell anybody their vaccine status. and you don't need to ask their vaccine status. And that's particularly true for 5 to 11, but it's also true for Tai Tamariki as well, that we don't need to actually know that. And if you're doing extracurricular activities in your kura, which could be sports, then you don't need to know the vaccine status for children to participate. Every child should be able to participate. If their whānau's made a decision they're not going to be vaccinated, we don't want children penalised for that. For private organisations, private sports organisations, clubs, they can still decide themselves, but I would encourage those groups to let every child participate. Okay, I think I've finished, Rawiri. I'm just going to summarise. We need to really focus on those layers of protection: masks, ventilation, cohorting, children not coming to school with symptoms, and children with symptoms being recognised early. Think about activities that children do outside of your school, when they're coming to school, when they're leaving school, when they're gathering with other children, because that's probably high risk when they're actually in the classroom. And 3, make use of the ministry ventilation teams, of people coming to assess the ventilation, make use of the CO2 monitors, and be aware that there's quite a few resources available to you. And if you're going to be putting applications in to have renovations in your classroom or have filtered air purifiers, this is a great time to do it before winter comes and all the other kura around the country are going to be wanting that. Kia ora, Rawiri.
Kia ora, Danny, good work. You've stretched the 6 minutes, but that's okay. That's good. We've got questions coming in. So some of them we're going to kind of throw back to the panel and some of them are being answered. But the question meister tonight's Dr. Anthony Jordan, over to you.
All right. So the first question that's come up, which I think is really important, and I'd be interested in everyone's opinion, is some of our kura are requesting a negative RAT before tamariki return to school. What's our opinion on that?
Well, I had a discussion with the ministry today about that, and I don't know, we don't have a legal standing on that at all. We can't legally require a child to bring back a negative RAT. What we can say, so if a child comes back and you can see they're coughing and spluttering and they're unwell, we need to be a little bit objective and say, take the COVID hat off. They've done their isolation time, and you've got to think, right, if the child was in this state and this was 3 years ago and it was just a normal ill, is that child able to continue coming to school, or are they just too unwell to be there? That's the line that I've been given from the Ministry of Ed. And I guess that's going on the science of on the levels of the virus in a child after that 10 days after, or 7 days now, sorry, after being infected. Yeah, so we've got to really decide, is this kid actually well enough to be at school, whether it's COVID or not? It is very tricky. We can request, but we cannot require. There's very few things that we can require around the illness stuff. It's just hard.
What do you think, Danny?
Kia ora, Anthony. I think the symptoms is much more important than the rapid antigen test. If a child has had an illness a week or 10 days ago, they've got better, now they haven't had symptoms for a few days, then I wouldn't be worried about the rapid antigen test.
Yeah, and we're finding here in Tamaki anyway that, you know, some people, if they're doing the wrong thing and keep testing, they can test positive for a lot longer than the isolation period, but their symptoms have resolved. So their ability to infect other people really has stopped. And the other thing is, there's someone brought it up just before around new or worsening symptoms. You know, some people may have baseline symptoms, some people may have cough, for example, as a normal thing. So it's just being able to set it to their baseline, because not everything completely goes away. And some symptoms from an infection control point of view aren't as worrisome as others. So some people may have headaches and muscle aches and feel a bit tired, but as long as the coughing, sneezing and hupe have gone, I'm less worried about their ability to infect others.
All right, so rapid antigen test on polite request. Kimiora, have you got a final comment?
Yeah, my community are taking it upon themselves to send their results into me. So even though, like Marama said, we don't require it, but we do take our lead off Dr. Rachel, and our community takes our lead off Dr. Rachel. So that's when the messaging is really important for us. And because Dr. Rachel is the queen down here for anything to do with health, the whole community and the whole iwi will listen to what Dr. Rachel says. Even though all over the news, they're saying that it's 7 days, down here, we're still running at 10 days. And that's just how Te Whānau Apanui roll. So kia ora.
Yeah, that's tino rangatiratanga, kia ora. Somebody's asked about the property managers, Ministry of Education. We're going to try and get that typed into and make that visible for everybody. But back to questions.
Yeah, and the last one is there any requirement for parents when they come to school to produce vaccine passes?
We'll go in reverse order, shall we? Start with Kimiora.
Oh, I don't really care what the motu says, but I think the majority of Te Whānau Apanui are vaccinated anyway, thanks to Dr. Rachel. So we don't ask for vaccinations when our parents come on. We do ask them though to make sure they're wearing masks, and they also do not enter into the school, and they scan their QR codes as soon as they come in. But yeah, I don't ask the parents coming onto the school grounds for vaccine passes or anything. Marama may have the legalities around that, but yeah, that's what we're doing down here.
Basically, we cannot prevent a parent from accessing their child, no matter what their status is. I can prevent adults that are not employed by me from entering a enclosed space like a classroom. So if a parent is coming in for a school visit or coming for an interview, or is the parent help, then yes, I do require, that's my discretion as the principal delegated by the board. I can say, I want the vaccine pass if you're entering into a classroom. Everyone else, I've just asked, please stay by your car, have a mask on, stay outdoors, and we will never stop you from accessing your children. You kind of have to go, do what's best for everyone in that case.
Rachel, do you have any comments? You've obviously been supporting Kimiora.
Kia ora, yeah. So I think that we've been suggesting, just because of we know that there's a less chance of infection after 10 days, that if kids can and parents can manage to keep them out for the 10 days, it's just going to reduce that risk. In terms of vaccine passes, I tend to agree. I think most people are vaccinated, but I think using those other methods is really important. So the masking and social distancing and stuff is probably just as critical.
Right. Hey, Danny, just coming back to you, just around, you're talking about ventilation. Some people have just asked, obviously in an open learning environment, it's hard without a room plan in front of you to design the perfect ventilation. What are some tips that you give to people? Because I've seen sort of pictures of fans facing out windows on one side of the room and the door on the other.
Yeah, look, all I can say is that you just have to try and imagine that hose coming in one side and going out the other side. The more you can think about fresh air coming in and stale air going out just in one direction, the easier it's going to be for you to visualize how to set up your room. But basically, as many doors and windows open as you can, and if you're going to have fans and things, have them pointing in one direction to aid that air going in one direction. If you can be outside, that's great. It's going to be harder in winter. If you haven't looked at the kidshealth.org.nz website, that's a site for health it's based on a group in Auckland, but it's for the whole country. It's got some really good videos about what happens when you breathe, what happens when you breathe on the mask on, with no mask on, and it's got some good tips about ventilation as well. So I recommend kidshealth.org.nz, and it's got a whole COVID section with lots of videos and tips.
Great. Hey, there's a lot of questions coming up on what the provision of masks are for Kura. So maybe back to you, Marama, in terms of how hard has it been to get a mask out of the hands of the Ministry of Health?
It was really hard, and now I have about 50,000. So like it's everywhere now, everywhere. So the legal mandated requirement is for year 4 up to be masked, but there are caveats. So if you've got a mixed level class, say there are more younger kids, so you've got a 2, 3, 4 class, if there's more younger kids, then the year 4s do not have to be masked. And then there's also the accommodations for hearing impaired children that need to be able to see your mouth to communicate. Then teachers and the children around them don't have to wear a mask. We have to use other methods. And same with special needs kids. We've got a few special needs kids who try really hard to wear a mask, but actually it's not working very well. So we have plenty of masks with the medical masks, so kids can swap those out quite often. It's quite tricky for little kids to manage that and putting them away. But yeah, there is plenty there. It is a bit tricky because it is very dependent on the classroom and on the needs of the kids at the time, and whether or not it's helping or is it causing more anxiety or is a barrier to learning. So yeah, it's very grey.
Rachel, have you been a conduit for your schools?
Actually, I think that mostly they've managed well. We needed to get some RATs tests out initially to our Kura for the staff, because I'm not a great advocate of rating kids, definitely not on the way back to school, because some of them test positive, they're not infectious. But that's just a hard concept to get across to everybody. But once you're positive, unless you're a critical worker, you never have to test again. That's just a hard concept because people think they want to be negative. So we got RATs out for the staff. But in mask wise, I think most people have got hold of them pretty well. I think some of the older kids are a bit reluctant to wear the surgical masks. They like their flash cloth masks and things. But I think most of the Kura have handled that pretty well. There's a little bit of, go to the shop and one teenager's wearing the mask, comes out, gives it to the next teenager who puts it on and goes into the shop. But, that's part of being a teenager.
Yeah, we've obviously encountered whānau that have struggled to get masks, and we've given masks out through the school. I'm glad the Ministry of Health are not listening. And that's a really good conduit of getting masks into homes, because actually we're not just thinking about what they do in the home. They spend what they do in the Kura. It's about what they do at home too. And this is about keeping them safe in all places. So I really like people to be able to access masks through schools. I think that's really useful.
And the Ministry of Ed has actually said, hey, here's all these millions of masks, give them out to your whānau. So every now and again I roam around and give it out like candy.
Yeah, we'd actually love the same thing to happen for rapid antigen testing. If those kits could be available at school, kids take them home and actually increases the testing by adults in the house as well.
They've actually just confirmed that today. We will be given RAT tests and we are able to send those RAT tests home for parents to use at home. Though we have to be very careful and very clear that schools cannot carry out those RAT tests themselves. You must always have written consent in order to stick anything up anyone's nose.
Great. There's one question that's come through. Can you contract COVID more than once? It is likely that once you catch it and you're confirmed positive that you won't get it again. So overseas, we've seen with various waves that yes, you can get COVID more than once, but actually the likelihood that you get COVID again in 3 months after having COVID is incredibly unlikely. It's actually much more likely that you get rhinovirus or something being at school if you've had COVID before, because this is not the only virus that'll be in town once we see the borders open and get a bit more movement. So yeah, pretty rare, under 3 months.
So we'll get all the Australian viruses, will we? Danny, can I go back to you? You mentioned a website, and I'm hoping that you might just say it again. So the question one of the people on the webinar tonight was asking is, where can we get good statistics? Where can we get good facts to support us? What's your recommendation?
I'm not sure about good statistics because it takes a little while for the new numbers to come through that are easily accessible to the public, which is one of the issues actually about people trusting the information they're hearing. But I just looked at that kidshealth.org.nz site today, and I thought that was really good. They look like really reliable, based on the evidence information, and that's gone through a lot of health experts to get onto that page. So I definitely would recommend that one. There was a question about property managers and ventilating schools, and I'm looking at Te Maho, where the COVID-19 advice from the Ministry of Education is putting their information now. So that's temaho.govt.nz, and I put that link up because there's a whole page on the resources for ventilating classrooms, and there's also a link to the property managers if you want to get a property manager to come and look at your site. So that should be available to everyone in one of those questions, or I can put it up somewhere else.
Yeah, nice. So if people click on the Q&A part, they look at the questions that have been answered, scroll down to the questions that are asking about property managers. Danny's typed an answer in there, and we'll probably put it on the chat as well so that everybody can see it in the chat. Great. All right, we've got some more questions coming in. Oh yeah, we got a question about so Kimiora's thing about the 10 days, 7 days. We had a question about, I think, really challenging the logic of the, household contacts, and somebody else tests positive, we're still letting all the household contacts go.
Yeah.
I think that is, the questioner is right, aren't they? That the logic is kind of a bit wobbly, but what we know from Delta was we had whānau in Auckland who were in isolation for 50 days, and that was really harmful. So we're balancing some harms here, yeah?
Yeah, and I think it's also a behavioural aspect, is when you've got lots of cases already circulating in the community and you're putting a whānau into isolation sequentially, week on week on week, people are just probably not going to do it at some point. So you lose a bit of goodwill in there if you don't actually say, hey, this is a trust model, stay home until you're better. And, we actually need to enable people to make good choices. When we force people to do things, we get resistance. If anything the last year has taught us, the more we double down, the harder it got to get people over the line.
Yeah. All right, plenty of aroha in there. Okay, there was another question that came in. I'm suspecting somebody's answered it already, but I thought it was one of the great ones for the night. Is there somewhere for Kura to access action plan templates? And it's kind of like people are reaching out to Marama and to Kimiora saying, oh, can you share your plans? I think that's what they're saying. Can you share your plans? Because other Kura are going to, they've got to make it work for them, but can they work off something somebody else has already tried?
So I'll put up the, we get a bulletin, and they're actually public. Oh, I just hear my daughter fall off something. My husband's there. So there is a big list of templates that I will put up. There's a whole section around advice for schools and Kura and everything they can do. Sorry, I'll stick the thing in the chat box.
Thank you.
Mama noa ke tō mātou rautaki, tō mātou prene. We sat down and linked our plan up to our to what we wanted to teach our kids and the objectives we wanted to teach our kids about living with COVID-19. And I think that was the main thing, is that we changed our way of thinking from us stopping COVID-19 to living with it. And when we sat down as a team and started to kōrero about it, we came up with the main one being communication to our staff, communication to our kids, and also out to our whānau. And then the second one was making sure that our staff were prepared to be flexible to move across the whole kura instead of being in their silos and teaching their group of kids. So in the case that our kaiako did get sick, touch wood, at the moment we haven't got many kids that are sick. The second one is all about supporting our whānau and their isolation while they're in isolation too, keeping that contact with them. Noting that down here in a geographically isolated community, and probably nothing different to Tāmaki Makaurau, but being so far away from everyone, away from the shops, we were able as a kura to still go out to those people, drop kai off at their gate, and it was just them seeing a different face instead of them having their own trials and tribulations of living 24/7 with each other. So yeah, there was another one. But our plan is pretty simple, really. It was just making sure that the communication throughout the whole of the team and also throughout our school community, they knew what we were all up to.
Yeah, kia ora. I think that's one of the things we've really noticed in the health system, is that we've got to have a plan for when our staff get affected. And so the fact that you've included some of that planning and thinking about how we manage through that, I'm imagining that's really important for some of the other kura. Question in the chat there was about plans for kohanga reo. And I'm hoping that somebody will jump into the Q&A, and instead of writing a question, we'll type in a place of where somebody might be able to go and see a template plan for COVID and kohanga reo whānau. And so that'd be really helpful. If you can do that, type it in now. We've got a few minutes left. Carry on.
Yeah, I was just going to reach out to Rachel and sort of get you to talk about how it has been for, supporting whānau with children going back to school in that sort of sequence where they may be asked to isolate for quite a long time.
Yeah, so the kura that Kimiora's working in has had fewer kids. One of our other schools been very badly hit because their kids come a long way on the buses, and the spread was in the bus, like one entire bus. Well, it's not a very big bus, but it was the entire bus. Every child and every adult who's been on that bus was positive. My thing is looking after these whānau is, if you have the capacity, sometimes what happens, the kids get it first, they bring it home, they get better, and they're bouncing around like little beans from day about 3, 4, 5, 6, 7, 8, 9, 10, that time. Then their parents get it. And especially with mamas or caregivers at home on their own, that time is really hard because they're sick and their kids are jumping like little beans everywhere. If you can provide mahi for those kids, or colouring for those kids, or Zooms for those kids, even though I know you're trying to run a classroom that's already got kids, sometimes just being able to run a Zoom or have something to distract them while the mother has a drink and a shower can sometimes be really, really useful. And also, I think after the kids get back to kura, some families are scared to send their kids back because they think they might get a hard time, or there might be issues around that. So I think the kids who've had COVID are the safest kids of the lot, because they're not going to have it, they're not going to share it, at least for 3 months. So those kids are your safest bet, really. And I think we just maybe education for the other children in the kura around the kids coming back is important, because they do feel a bit stigmatized, and some whānau have been reluctant to send their kids back because of that. I think those are my two things around supporting those whānau, really. It's hard. And what we've had to do with a few families is people who've already had COVID, like if it's a sister who's already had COVID, that sister has actually taken those kids for a couple of days, or a day or two. And there has to be worked out, obviously it's breaking bubbles, but I think as we progress through this, there's going to be some people who've had COVID and are within their 3 months and can give a break to those ones, especially, I've got a hapu mama who's got COVID now and got really active kids at home, and it's hard, and she's sick. So anyway, that's just another thought where Kura could feed into supporting those whānaus who are at home and educating the other kids for when those kids come back.
Yeah, I think that's a great thing to share around. You know, we still need to support one another. It's not like we can just lock people up. They are actually sick as well. So we need to be a little bit pragmatic here. You know, there's bubble breaking, and then there's survival mode, isn't there? You got to be a little bit more understanding for whānau out there.
Yeah, all right. Hey,
and sorry, one more
Go ahead,
comment.
Rachel.
Just because schools have been a big thing down here, the buses. And one great idea that one of the Kura have is they have someone at the door of the bus, because our kids come from a long way on their bus. So if they turn up to school sick, it's a long way to send them home. So children who are unwell and febrile and not looking well get turned off the bus before they get on the bus, rather than getting to school and then getting asked to be picked up. And they've got someone monitoring the kids as they get on, which has been, I think, great right throughout the whole process. And that's maybe a useful thing for rural schools.
Kia ora. Thanks, Rachel. Hey, shout out to you, Rachel. Apanui, deadly, doing a really amazing job. And Kimiora, so the whole, you know, the sovereign movement down there, Apanui, beautiful, well done. There are no questions left to answer. There's some people using the question and answer just to mihi to our panelists, and thank you for doing that. It's a very Māori thing to do. Nā mihi ki o koutou panelists. Marama, Kimiora, really grateful for you joining us tonight. Danny, thank you for being with us. Thank you for sharing that. You heard it here first. The Ministry of Education is going to make sure that rats get distributed through school communities. Thank you for that, Marama. We've got some things that are typed into the chat where you can go and see you know, the ventilating schools information, how to order the masks, you know, those sorts of things. So thanks. If you've got a moment, dive into that and grab that information. This webinar, we're going to edit it and make it, you know, shiny, and we're going to put it up on the website. My last mihi is to our sponsors. That's Uruta, Wirohia, Ngā Pai o te Maramatanga, ka mihi ki o koutou, tautoko mai wēnei mahi, ka mihi ki a koutou, I tūhono mai tēnei pō, tēnā koutou, kia ora tātou katoa.
Ana tamanui te rā e ki runga i a whaira wae Heke mai ko te marangai waipuke tia Ngā tiriti o te motu e te tangata e ki Ka whiti ana tamanui te rā e ki Maranga kia mau kia ita Heru nui, heru roa, naru wai moko te runei ha Kia hakarongo te ao katoa, wa he katoa te pā Tirohia ngā whenua, tirohia ngā moana Tirohia ngā tangata, wariro atu rā e ki Ka whiti ana tawaru i te rā e ki I a whaira wae Heke mai ko te marangai waipuke tia Ngā tiriti o te motu e te tangata wae ki Ka whiti ana tamanu i te rā e ki Maranga kia mau kia ita He au nui, he au roa Nā tangaroa te au nei ha Kia are te ao katoa Kua he katoa te wā Me hoki haka murira Ki ngā kupu o rehera Toi tū te kupu me te mana Toi tū te whenua Daram 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 bum bum But
Kia ora tātou. Thank you for joining our webinar on Omicron tonight.
And we just wanted people to be able to ask questions and have answer their worries and then go away and think.
You know, for better or worse, we are still in a really good position compared to some other countries who've experienced these big surges.
We've got to protect our workforce, probably like all Māori providers. The issue I have is trying to stop our kaimahi from trying to work 24/7.
So COVID's not only an infectious disease, it is a mental illness pandemic as well.
It's a very normal human neurological reaction to become hypervigilant, or in other words, on edge, when faced with uncertainty and change.
Actually, it's less about infectious control and it's more about saving Māori lives.
And kia kaha tātou, we can do it because we you know, manaki's in our bones and we can look after each other, and I think that's where it's at.
Kia ora tātou, ngā mihi.